There are warnings that Africa, a region with some of the most vulnerable health systems, could be heading for a new wave in the pandemic. I'm James Chau, I call Georgia Arnold, head of MTV Staying Alive, a foundation I'm a trustee of that produces the award-winning television show MTV Sugar. For years, MTV Sugar has helped prevent the spread of HIV and AIDS, and in so doing allowed the people of Africa to help us achieve an AIDS-free world. Now, MTV Sugar is breaking new ground by producing a special and ongoing series that pivots its knowledge fighting AIDS to fighting a new global threat. Georgia tells us how this new chapter in MTV Sugar began.
So overnight, we're all working at home. We had our scriptwriters and our directors in Nigeria and South Africa. Our cast all had to film from home, so they would take their cameras and they'd show us around their homes so we could decide where to film with them. And we filmed everything on Zoom with mobile phone as a backup, and the director would be down the line watching them. It was quite tough to do, but at the end of the day, it was an incredible experience to reinvent the way we work. It turned everything we knew upside down.
In the AIDS epidemic, it was political leadership and community leadership that changed the ball game. Is that the same here now?
My heart breaks. My heart breaks for this moment that we're in, where there is a distinct lack of good leadership across the world, when we have never needed it more. We need people who the world trusts, who are able to be honest with us and are able to be decisive in their actions. Take Nigeria, for example. They know how to knock door to door. They know how to reach everybody in the most rural of areas. And that's what I think has come into play here with COVID.
There were real concerns at the start of the pandemic that the floor would literally fall out over in Africa. Where do you think they've got it, if not right, but got it better than many of the advanced economies in the world today?
You know, in some ways, Africa had a strange advantage, but they had the advantage because they were scared. And I'm generalizing across the continent, but they were scared because of their previous experience with Ebola. And that, I think, played into the communities listening to public health messaging. It also, from where I'm sitting, it seems that it hasn't been politicized. And that's really important because it means that people don't think someone's making a decision because it's going to make them look good or because that's what their party wants them to do. It's because it's for the good of the people. And then I think, there are some obvious ones. I think the median age across the continent is 19 years old. And over 80% of infections in Africa have been asymptomatic among young people.
You're so brilliant at communicating and touching people's emotions along the way. What would you say about communicating the urgency of COVID-19, and how has MTV Sugar informed you that far?
Clarity is key. If we don't see clear communication in messages, then everything is suddenly I feel like we're picking away at the edges. There is something around public health messaging, but versus human behavior. They don't always match together, and we can't expect everybody to follow it. And so we have to be a little bit flexible in what we do. There are some simple things that I as an individual can do to protect myself. It's not going to be 100% fail-safe. But I know that if I do wear a mask, if I do wash my hands, if I do keep social distances, I am probably not going to catch COVID.
I am James Chau. You're watching The China Current. Follow us on social media @The China Current.